felt like maybe I was pregnant, but I wasn't.
Well, it hits you a little harder than pregnancy even.
Yeah.
And Diana, how about for you? You were around 30 when you had your stroke.
I was. It was a year ago. I didn't have any risk factors to my knowledge. I was really healthy and active, and I'd been surfing the day of and done yoga, and it ended up I had a tiny tear in my artery in my neck.
So we would not have known it ahead of time. This is why it's so important for all of us today. These women are proof that stroke doesn't just happen to people who are older and sicker. It happens to very young people in the prime of their lives doing all the right things. The question is, would you know if you were at risk? Take a look.
It's no longer just your grandmother's disease or your grandfather's. Each year, almost 500,000 women suffer a stroke. That's 55,000 more than men. And while the average age of a stroke victim is 68, far more alarming is the up to 23% rise in stroke among younger women over the last 20 years. And if you're a woman, you're more likely to die, partly because your symptoms and risk factors are different from men and more easily missed. The classic risk factors for stroke apply to everyone, but women must also add to that list migraines, depression, pregnancy, the pill, and maybe even drinking soda. Just one glass a day, sugary or diet, or sweetened fruit juice. Now that you know the risks, today, the surprising stroke symptoms every woman must know.
So let me start by showing you what happens inside your body during a stroke. If you understand this, you'll understand why these symptoms are so essential to appreciate. So when you have a blood clot, it often will, for example, form in a large vessel. And that little clot can fly up, and it gets to be caught in these small little tributaries, little streams that come off the big arteries. When it goes there, it blocks up all the oxygen and blood that would normally give life to this part of the brain, hits it like it's a Charlie horse, and that part of the brain begins to die. You begin to feel the symptoms here, but it might not always present the way you think it would, because depending on what part of the brain you've injured, you can get a very different symptom from the person next to you having similar kinds of a problem. So Jennifer, Megan, and Diana all joined us. They had strokes when they were young, and you all were willing to share your stories to help teach everybody what the signs are of having a stroke. So the warning signs are important so you can get the help you need fast. And fast is not just the speed at which you get help, it's also an important clue to keeping track of what are the key symptoms. So the F in fast stands for face drooping. It's going to be on one side of your face. So Jennifer, what was that drooping like?
It wasn't something I felt, but my right side of my face was drooping. When I went to the ER, they told me to smile. I thought I was smiling perfect, like a model, but I wasn't. My coworkers and my family saw that I was, my right side of my face was drooping, and they told me like a month after.
So it was your coworkers who saw that you were not smiling correctly initially?
Yes, and my family in the ER. It's
important to point this out because it'll often be someone that you know who has the problem, so you know what your smile normally looks like, you can tell the difference. So if you smile, it doesn't look nice and symmetrical and beautiful like Jennifer's, and one side will droop down usually, especially if the person doesn't realize it's happening. You got to call 911. Don't pass go. Don't collect $200. That's an important sign. Next in the FAST acronym is A. A stands for arm weakness. So it's also going to be on one side of your body. It won't be on both sides. One arm will be weak and the other one won't. Here's why that happens. When the blood clots, what happens? It blocks off, as I just showed you, the blood supply to that part of your brain. The opposite side of the body, away from that side, will have the symptoms, but it'll be that entire side of the body. So it'll be the left arm and the left leg if you've got a right brain problem. So Megan, what did this weakness feel like to you?
Well, I was holding a bowl, and I had this sudden thought of, I'm going to drop this bowl, and sure enough, I did. I dropped the bowl, and I went to clean it up. I tried to take a drink, and the drink was way too heavy for me, so I asked my husband to hold the drink for me. And for some reason, I said, will you pinch my hand? I don't know what made me think about that, but I asked my husband to pinch my hand, and I'm looking at him, I'm waiting for him to pinch my hand, and I look down, and there's a big nail divot in my hand. Oh, wow. And we immediately went to the ER.
Because you lost a sense of sensation as well as the ability to move it. So we can all do this right now. Everyone do this, put your hands in front of you, and then just raise them up and see if they're symmetrical. Right? And then put them back down next to you, and raise them one more time up. And these are simple little tests, but they're life-saving tests because they also assess whether you can understand what the person's telling you. So both with the smiling and with the arm raising, it gives us multiple clues all at once. All right, the S in FAST stands for speech. Diana, I would like to hear your story. How did your speech change?
Well, I couldn't speak. First, my right arm went numb, and I was trying to tell my boyfriend something's wrong. in my head, I was saying, something's wrong, call my dad, who's a physician. And the words, though, coming out, what I heard were just gibberish.
Yeah. You know, it's remarkable. I hear this also, that there's a lack of understanding and disorientation that happens along with this. So the test that I would normally give someone is, that, you know, a little tongue twister. Say that the grass is green. Right? If you say the grass is green, there's no problems, then you don't have a speech issue. But it's something that's simple, seemingly simple like that, becomes a difficult chore for someone to get out, or it's garbled when you say it out. That's the sign that I'm speaking to. And finally, T is for time, because you don't have a lot of it. You got to get to the hospital as soon as possible. In fact, the neurologists, the brain doctors say that time is brain. The seconds you wait will hurt your brain further. The faster you get to the help you need, the better your chance for a full recovery. I cannot thank all three of you enough. I know it's difficult, especially when you're young and you've had a life-threatening problem, just to be public about it, and I appreciate you coming here.
Thank you.
Right. Now, in addition to the classic stroke symptoms we just talked about, just like heart attacks, there are subtle signs that every woman needs to know. So subtle signs I want to focus on today. Here to explain them is Dr. Carolyn Brockington. She's a neurologist and director of a leading stroke center here in New York. So besides, welcome, Carolyn. Besides the fast signs that our young women all articulated so beautifully, what are the other signs that happen in women that are sort of unique, sort of different, unexpected?
Well, you know, it depends on the part of the brain that's affected. So you might have problems with vision, where suddenly you have double vision, or you can't see very well out of one eye. You might have problems with coordination, where you're walking almost as if you're drunk, but you know you're not drunk, so something's wrong. Or sometimes people can have a sudden headache. You know, everybody has headaches, but a headache that is out of proportion to what you normally have, the most severe headache of your life, that's a problem. And then as you were discussing, you know, we can have milder, women can have milder symptoms of stroke. So sometimes they can present with disorientation, sometimes problems all of a sudden nausea and vomiting, or sometimes problems where they're just having isolated hiccups, which is fairly rare, but it's a constellation of symptoms, and the symptoms are sudden, right? You said act fast. So these are symptoms that are going to happen over seconds to minutes, not days, months, weeks, but really suddenly.
So we put all those signs behind me. Take a look at them. In addition to the FAST, F-A-S-T, these are the other symptoms I want women to know about. I want you to memorize them if you can. Learn these symptoms, not just for you, everybody, but learn them for the people that you're with. We heard about coworkers identifying symptoms, family, obviously. Absolutely. You walk through by someone on the street and notice it, and you can be the lifesaver. So the more you know about these, the more lives we can make a difference of. In addition to heading off to the ER, if you've got these signs, and generally you want to have 2 of these signs to really clue you in. So any one sign at all, I don't panic over, but 2 or more, you get concerned.
And suddenly.
And suddenly. Now, when you get to the ER, you've got a very important tip that can really help a lot of us.
Well, both. When you think you're having signs and symptoms of a stroke, you call 911 right away, because they'll come and get you and take you to the closest hospital that has a designated stroke center. But also when you get to the hospital, you need to say, I think I'm having a stroke. Don't just list your symptoms. Particularly, you know, you saw that your patients here, or the people here, were very young, and we know that anybody can have a stroke. But sometimes if you're young, people think, hey, you're not having a stroke, it's something else. But you have to tell them, I think I'm having a stroke, and these are symptoms I've never had before. So you have to clue people in that something's wrong to get rapid evaluation and treatment.
Be a smart patient and save yourself.
Absolutely. You know, time is brain, as you said, and it's very important to get the treatment right away.
Maybe even take a video selfie.
You need to learn on DrOz.com. Be right back.
If you have a smartphone, you can also
learn the warning signs of a stroke. I shared it with my mom, and 5 weeks later, she had one. Luckily, we knew exactly what to do. It saved her life.
Share your story on Dr. Oz's Facebook page.
you can also take a video selfie.
Do you enjoy eating cheese and ice cream, but your stomach doesn't? If you feel bloated and cramped afterwards, you could be dairy sensitive. Find out if you are. The plan for anyone who loves dairy but doesn't want to give it up is next. Promotional